Hi, this is Dr. Nishal, and in this video we're going to be talking about depression and how to manage it naturally and effectively, and what are some alternatives to standard antidepressants. Well, the first thing I'd like to say before we get into any of that is that it's very important in clinical depression to get counseling. You need to go and see somebody that you can talk to and get counseling. That's the first thing before we get into any of the juicy details. So, what can be done about this? Well, we know that depression is associated with low levels of serotonin in the brain, at least circulating in the brain. So, how is serotonin made? We need to support the production of serotonin first before we inhibit the reuptake of it, because there tends to be this one factor in that some people who tend to be prone to depression have a part of their brain that produces serotonin a little smaller. So that's one issue. And at the same time, nutrition is another issue. And both of these need to be targeted at the same time. So let's look at nutrition first. Serotonin is made from tryptophan. Tryptophan is basically an amino acid that you get from your food. You can get it from turkey, chicken, eggs, dairy, and it gets converted into 5-HTP, which is basically 5-hydroxytryptamine, and that gets converted into serotonin, which is that feel good, feel nice neurotransmitter in the brain, and that's what's usually deficient in people who have depression. So getting foods that are rich in tryptophan, making sure that gut bacteria, meaning your probiotics, are proper, you're getting a good amount of that, and making sure that you're getting a correct amount of B vitamins as well. Specifically, B6 is very important. And so that covers the nutritional aspect of serotonin. How do we prevent the reuptake of serotonin? That is done with St. John's wort. St. John's wort is proven to be just as effective without the side effects of antidepressants. So it's just as effective as your standard antidepressants, no side effects. Well, what are the side effects with antidepressants? Well, it can affect your relationships. It can affect sexual health. You have reduced sexual desire. It alters your dopamine levels as well. And that can be a problem when it comes to experiencing other emotions. And so some people notice a huge change, personality change, when on antidepressants. And by taking St. John's wort, we don't tend to see those things. And I will put all of the studies in the description so that you can go ahead and take a look at this yourself. Now, what else can do it? Well, licorice root can do this as well. Licorice root is great for inhibiting serotonin reuptake. And in addition to the nutrition and these medicinal supplements, these herbal supplements, meditation is extremely important as well. Yoga and meditation are really good for the body. Meditation specifically is showing a lot of promising results when it comes to depression and anxiety and overall well-being, feeling of well-being. Meditation is a great tool, and I will put the studies for that as well. So these are three things that I'd like you to look at. Nutrition, that means tryptophan-rich foods, getting enough gut bacteria, that means probiotics, B6, vitamin B6, and then serotonin reuptake inhibitors that are herbal. So we're talking about St. John's wort or licorice root, preferably St. John's wort. Some people have trouble with licorice root and high blood pressure, especially when they take it long term and in high doses. And the final thing is meditation. These are the three tools that I would recommend using for managing this condition naturally and effectively. So I hope this information helps you. And if you'd like to get in touch with me, you can do so through my website, drnishal.com, DOCTORNISHAL.com. And I do online consultations for people all over the world. And you can come to the clinic as well. And all that information is on the website. I will see you in the next video.